Hello everyone, Dr. Abby here with CHIRO for Moms, and today we are talking more about being a cash practice. Last week we really dived into more topics about being a niche practice, how you can yourself niche down, and this week is more about how to be a cash practice, and we've really talked about the difference between cash and insurance-based practices, why we love being a cash practice, and the freedoms we're able to have in our treatment plans and how we kind of set up the clinic and what's made us so successful and being able to share those with you. But that doesn't mean it doesn't come with difficulties. Like any practice, there are always speed bumps. There's always things to think about. The road to get there may not always be the smoothest, but the outcomes are. And the goal that you are setting is well worth the trials and tribulations to get there. So today I want to take a few moments to just talk about what are some things you might need to think about. What are those difficult maybe moments that you can prepare yourself for, and kind of like what is your game plan. And one of those is the marketing aspect. And so marketing yourself as a cash practice is easy, right? Because marketing in itself is just how you word things and how you promote yourselves. But our society is built upon wanting to use insurance. You know, families, individuals are paying into insurance if they have that, and they want to be able to use it, right? And I don't blame them. I don't think anyone can blame, like, if you're paying into insurance, you want to be able to use said insurance. But jump back to our video from last week when we talked about insurance does dictate the treatment plan. And so when you're someone that doesn't really want a treatment plan, when you have a population of people who might not be able to adhere to a treatment plan, using insurance can become quite difficult. So being the cash side, well, I don't want to say convincing someone to use cash, but giving those options and maybe being able to explain to them the pros and cons between using cash and insurance for their individual treatment plan, for their individual care, is something to consider. So I can market myself as a cash practice, but then having people come in that are going to use cash might be a little bit more difficult. So just know that going in, right? There's nothing wrong about using it. It's just making sure that your patients are informed of why aren't you using insurance, right? Why aren't you collecting that information? And it's because I want to be able to serve you the best way that I can and give you the freedom to decide how often you want to be here, what you're coming in for, what I'm able to do as a provider, because there are some modalities, especially in a chiropractic office, that might not be covered. Ourselves, we don't use any ultrasound or stim units, but there are a lot of offices that do. And so now as a provider, you have to look at which modality can my patient use for insurance and which one may not be. And that can make a big difference. You know, if someone wants to use that stim machine and it's not covered by insurance, are they willing to pay out of pocket? Are you giving them the option to pay out of pocket? Or if you were to go all cash, are you able to now make it maybe a more cost-effective option than the insurance copay, the out-of-pocket? Because a lot of times they don't offer those modalities within the treatment themselves. On the flip side of that, there is a pressure to perform. And again, not in a scary way, not in a I'm worried people aren't going to come back way, but in a way of analogy for you. For all my ladies out there, you can totally get this. For all the guys out there, I will think of another analogy for you. Or maybe your partner, you understand where your partner may be coming from as well. When you go get your hair done, if you were to get a cut and color or foil, balayage, you name your service, you are often paying cash, you're paying a debit card, you're paying a credit card. Their insurance unfortunately doesn't pay for hair. You expect it to come out a certain way. You expect the service to be a certain way. You expect and trust that your stylist is cutting it the right length, isn't missing a part, is coloring it the right color, knows what they're doing, styling it the right way, using the right products. And so that when you walk out, you don't like your hair, you love your hair. And I think that's a great analogy to go into when you're coming into that cash practice. When they walk in, you have advertised yourselves as the specialty clinic, as the niche down clinic, and you are the expert. When they walk in, they expect to walk out feeling a little bit better than what they came in. That is always my goal as a provider. And I always promise, I'm like, I can't perform miracles, right? If it's an acute issue, it might take a little bit to get there. But I'm going to give you the homework to get there so that you don't have to be in office. But they're expecting to feel a certain way. So there is that pressure that's, okay, I need to make sure that I do hit all the muscles. I do need to make sure that I address their problem areas. I do need to make sure that maybe sometimes I have to think a little bit outside of the box. If they're having neck pain, is it their jaw? Is it their ear? There are connection points that now you need to address so that they go, yes, they are different. They are specialty and they know what they're doing, and we all know what we're doing. We all graduated school, we all went to school, we're all licensed, but it's just that difference that they are expecting to walk out a little bit different because you've advertised yourself that way. So those two things, that pressure to perform and then actually getting people in the door, challenging them that like it's okay to pay cash, because I'm going to give you the freedom then back, rather than tying you down into a treatment plan, because insurance is the only way, that's the only way that insurance is then going to cover it. So those are the two big kahunas when you're thinking about, going cash, are the difficulties. It's not always easy, but man, is it incredible once you get there. And really think about, 2 weeks ago, we had a whole series also about cash practice. And so I encourage you to also look at those and hit subscribe, follow us on our channel. We're always here to serve you guys the best way that we can, giving you more information about how to be a cash practice, how to niche down, so that you can have the practice of your dreams, right? However that looks for you. So stay tuned. Let us know what questions you have. Leave them in the comments. And we look forward to getting you more content here soon.